I had to do it myself.
We are back here on the Lynn Hayes Freeland Show. One of the things I said at the beginning of the show is as you start the new year, you think about different things. Last week we talked about eating well, we talked about exercising, and health is going to be a big part of all of the conversations in 2018, at least here on the Lynn Hayes Freeland Show. But what you may not be familiar with is a program called PA Cares for Us, All of Us Research Program. Didn't know about it, did you? Here to talk about it is Dr. Mylinda Masert. She is the co-investigator for PA Cares for U.S. Research Program at the University of Pittsburgh. That's a whole lot to say. But the bottom line is this is really an exciting opportunity.
It's very exciting. Thanks for having us on the show to talk about it today. So the All of Us National Research Program is an NIH, National Institute of Health, sponsored research program that started in 2015 and is launching full force this spring in 2018.
Okay.
So although maybe not so many people have heard about it yet, very soon people are going to hear lots and lots and see commercials and billboards and the full promotion that will launch later this spring. So what it boils down to is this is a research program across the country to advance what's called precision medicine. This is how we envision the next step of practicing medicine and taking medicine to that next level. Precision medicine is really about taking care of patients not as a cookie cutter. We do not all come from the same mold, but really recognizing that we are each individual and all of our individual experience, our environmental exposures, our nutrition, our genetics, our family health history, all of those impact our personal health. And when we make healthcare decisions, whether it be for preventative care or actually treating medical conditions, we need to factor all of that in.
Okay.
So that's really the next level of advancing medicine. And that really means different things to different people. Because precision medicine is about the unique person, everyone has their unique story.
Everyone has a story.
And their unique connection to this research concept and this idea of how to practice medicine. So for many people, that could be a history of cancer in their family and really trying to understand, first of all, why did that person develop cancer? Was it genetic? Was it environmental? Was it a combination of the two? And then, you know, how do we design the best cancer treatment for each unique individual? Because not all cancers are the same, even when we call them a lung cancer or a brain cancer. Those are all unique and different. And so now with advancing precision medicine and doing this type of research, we'll be able to tailor that treatment. My own family story relates to depression. So my grandmother was very, very depressed. And I take care of patients with depression all the time in the office. And when we decide that your depression is severe enough that we need to start someone on some medication, there are many, many medications from which to choose.
Okay.
And really, right now, I'm sort of throwing a dart at a dartboard and hoping I hit that bullseye.
To try to figure out which is the right one for this case.
Exactly, right? So I might ask the person if they were ever on anything before that worked for them, or if anyone in their family took anything that worked for them. But really, I'm just going, you know, on the best literature, everything that's published, and throwing that dart and hoping I hit the bullseye the first time out. Then the patient comes back a few weeks later. Maybe their symptoms are better, maybe they're not, maybe they had a side effect and stopped the medicine.
Okay.
So then we have to decide what to do next. Do we increase the dose? Do we go to a different medicine altogether? And this could play out for many, many months. And during that time, the patient is suffering. They're suffering with their symptoms.
And now the patient is getting frustrated.
They're frustrated.
Because they're feeling like nothing's helping.
And they may lose their job as a consequence of their inability to function. They may lose their marriage, or worst of all, which is what happened in my family, is they could commit suicide, which is the ultimate tragedy. And so precision medicine is looking at the genetics, taking all that family history, all the information from the electronic medical record, putting that together and helping me pick that right medicine from the get-go, and really ensuring that I hit that bullseye the first time out, which means really getting therapeutic success for that patient as fast as possible. So that's what precision medicine means to me. But it could mean so many things. I have this amazing family in my office. Everyone in this person's family has diabetes. And so when I told them about this study, they were so excited. They said, I always wondered, why does everyone in my family have diabetes? And some people get it when they're 20, and other people don't get it till they're 70. Why is that? Is it because of their diet? Is it where they live in the city is different?
What are all the factors?
What are all the factors? That is precision medicine.
Hold that thought right there, because now we're going to take a commercial break. When we come back, we're going to tell folks in the audience how they fit into this whole process. We have a lot more to do this morning on the Lynn Hayes Freeland Show, so don't go away.
More people watch KDKA News at 6 than